Yes, okay. Good evening. Today, the topic is mood disorders. Mood disorders means MOOD, mood, happiness or sadness. These are all the two moods. Someone asks you what is your mood means, are you happy or are you sad? But if you think about this mood, there is an extreme sadness. We call it as depression. Depression is extreme sadness. There is also extreme happiness, abnormal happiness, that is known by the name mania. Anyway, first mood disorder I want to discuss with you is depressive disorder. Let me talk about the depression. Major depression or minor depression. Anyway, depressive disorder. Someone becoming sad tomorrow, a day later after he become happy, then that is not the depression. Actually, depressed mood lasting for 2 weeks, at least for 2 weeks, then it is known by the name depressive mood. The person will be very sad. He is indifferent from others, apathetic or irritability. Apathy or irritability. Along with the change in sleep will change, appetite, hunger will change, there will be change in weight also. Let me repeat, weight will change, appetite, hunger will change, sleep will change. This person will wake up at early. More than that, let me repeat other symptoms, irritability or apathy. Apathy means no emotions, indifference and sadness. That is what known by the name depression. If you observe more, there will be motor agitation or retardation. He will be very fatigued, impaired concentration, even thoughts of death. That's why doctors telling that those who are in major depression are more prone to do suicide. While diagnosing the disease, you have to distinguish from bipolar disease. More than that, there are some depressive disorder due to medication and due to some disease. The medication and diseases are causing some depression. That depression you have to distinguish from the normal depression. The treatment options are normally antidepressant drugs. Before we used TCA, now we are using SSRI. Anyway, more than that, we can do some psychotherapies like cognitive behavioral therapy with CBT or interpersonal therapy, and the drug, the medicines along with this psychological therapy will make the depression more curable, or the person is able to lead a new life. And more than that, we can prescribe for this patient regular exercise, healthy diet and adequate sleep. Again, I'm telling, regular exercise, healthy diet and adequate sleep, we can recover from depression. Okay. Now, while you think about depression, you have to exclude the depression due to diseases or medication. I'm coming to the point that suppose a cardiac patient or a cancer patient or a neurological patient, cardiac patient, neurological patient or cancer patient, he may have depression that not a psychiatric depression. The medication like antihypertensive, anticholesterolic drugs, antiarrhythmic drugs also cause depression, but it is not a psychiatric depression. Even let me add to some diseases more, thyroid disorders. Thyroid disorders have an ability to make the person depressed. Diabetes mellitus, HIV also prone to depression. Now let me talk about more serious, comparatively more serious mood disorder, that is bipolar disease. Bipolar disease means two poles are there, poles of happiness, poles of sadness. And the mood is alternating between sadness and happiness. Extreme sadness and extreme happiness. Extreme sadness we call depression, then extreme happiness we call mania. So there is a cycling of mania and depression in bipolar disorder. There will be increased psychomotor activity, social extroversion, not introversion, extroversion, decreased need of sleep, impulsivity, elated mode, along with anxiety and irritability. These are all the symptoms of this manic disorder. Let me repeat, irritability and anxiety. Then impulsivity and elation. Decreased need of sleep, psychomotor activity increased, and extroversion also present. Treatment for bipolar disease. Now let's have a look at treatment for bipolar disorders. The first treatment in the bipolar disorder is the most side effect causing and most effective lithium carbonate, lithium. Then the second drug is antipsychotic agents like aripiprazole, isoniazid, cariprazine, olanzapine, quetiapine, and risperidone. These are all the antipsychotic agents by which we can treat the bipolar disease. And valproic acid is used in rapid cycling mania and depression, bipolar disorder, but it causes tremor and weight gain. Combination of this therapy, combination of antipsychotic and valproic acid or along with lithium is most effective. Thank you.